So we have a 70-year-old male who was referred to the CT department for a CT scan, complaining of epistaxis along with impaired hearing and also a neck lump. Now in this non-contrast CT, I'll give you a few seconds to see if you can highlight the radiographic significance and pathologies associated. To make things a bit easier, I will also switch over to the axial C plus the portal venous phase to assist in making a diagnosis in this contrasted CT scan. Now right off the bat, we can see a very large mass located on the right side of the nasopharynx respectively. If we focus on it more, we can see the mass is measuring about 45 by 35 millimeters with heterogeneous enhancements, and necrotic area seems to arise around the nasopharyngeal mucosal space right around here. The tumor does cross the midline to the left nasopharyngeal space. Now right off the bat, we can see that the mass envelops the prevertebral space right around here, along with retropharyngeal space right here, also the parapharyngeal space right here. If we also pay attention right around here very closely, we can see that the mass actually seems to have enveloped parts of the masticator space, including the tensor veli palatini, the longus colli, and the pterygoid muscles respectively, which can affect the deglutition and mastication in many cases. Now, what I'm very focused about here is actually this significant amount of bone loss we can determine right around here. Now, I will switch over to the axial bone window to better visualize the osteological investigations and findings. Now, right off the bat, we can actually see the clivus right here. If we move more superiorly, we can see the clivus right here. And if we move more inferiorly, we can see the apex of the petrous, okay, which is very, very important. And we can see that the clivus and the apex of the petrous have been eroded by this mass. And we will check more inferiorly actually to check if the occipital condyles have been affected, and obviously fortunately they have not been affected, and the atlantoaxial joint seems very, very well. And obviously we can see that the eustachian tube has been blocked in the path of this mass. And if we move back onto the axial C plus the portal venous phase, we can actually see another important radiographic finding. If we move inferiorly right around here, if we just move a little bit, you can see we have a very interesting mass right here, which could be a lymphoadenopathy. And this could measure around 40 by 20 millimeters, and it will need a biopsy, of course. Now, if we check around here, we can actually see that the bilateral foramen rotundum, along with the foramen ovale and the left foramen lacerum are preserved. The right foramen lacerum seems to be eroded quite well. Actually, it's been eroded. And the tumor encroaches the hypoglossal canal, which is why I really focused on the occipital condyles, because it seems to have encroached the right hypoglossal canal and affecting the hypoglossal nerve and its innervations. So any muscle weakness should be noted immediately. And besides that, if we check the sinuses, there seems to be no significant pathology associated with them. And also, if we check the parotid glands respectively, they seem to be very well maintained and not enlarged, along with the different muscles including the masseter, the buccinator. The mandible seems very well maintained, along with the superficial temporal arteries and blood vessels and nerves seem very well defined. So this concludes this diagnostic radiograph, and I hope that this video was very useful.